Hello there, everyone. Good afternoon, morning, evening, whenever you're watching this. Welcome. Today we are going to talk about our last two modules in in Unit 8. So let's go ahead and get right to those. They are Module 72, which is Evaluating Psychotherapies, which were any of those talk therapies that Ms. Jessel told you about last time. And Module 73 is your biomedical therapies, so alternatives to psychotherapies, which include some drug therapies. So starting with evaluating our psychotherapies here, one study showed 90% of people who shared their experiences with mental health professionals were at least fairly well satisfied. Okay, so most people are saying, yeah, it seems like this is working for me. Among those who recalled feeling fair or very poor when beginning therapy, 9 in 10 now are feeling very good, good, or at least so-so. So that tells us it seems like there's some kind of improvement there because of psychotherapy. But there are some reasons that we might be a little skeptical of these results. So, first of all, people often enter therapy in crisis, meaning they're kind of at one of their lowest points that you would naturally over time see people start to climb back up, anyways. That maybe it's really not the therapy, it was just the course of time. Another reason is clients believe that therapy will help. And then, hint, hint, placebo effect, if you remember that, that kind of helps to heal the person too. So, again, maybe not the therapist, but more of, I really want this to work. So, maybe it will. And then it does. Also, clients generally speak kindly of their therapists, even if there are problems or unresolved issues. So, even though the person might not necessarily feel like the therapy totally helped them, they still would say good things about it. And finally, the client wants to believe the therapy was worth the time and effort. You don't want to just have this whole thing that you went through be a waste of your time. So you might be a little more unconsciously willing to say, yeah, I think that that was really helpful for me. What about clinicians, the people who are kind of helping to give the therapy and those studying it? What do they think? Do they think that it works? There are a lot of cases of successful psychotherapy. However, therapists, like all humans, are prone to the cognitive errors such as confirmation bias. And then that means they might only perceive the positive client comments that support what the therapist already believes about the therapy. So, again, we've got like our bias here a little bit too of you want to see it work. So then you kind of just look for the things that support your belief that it does work. So, like our client testimonials, psychotherapist claims may also be subject to human bias. And as with other enduring questions, psychologists turn to research. So, one kind of research is called a meta analysis. That is a research term that you should know, meaning that rather than it being its own new study where they're conducting this new experiment or correlational study or whatever, it is a compilation of a bunch of different studies that have already been done, and it's just gathering the research together from all of those studies, putting them together in one place, like one big document, and saying, so let's break down all these results that we see from all these different studies. So, simply said, meta analyses give us the bottom line result of a lot of studies. And meta analysis shows for the success of psychotherapy that from 475 studies, it shows the improvement of untreated people and psychotherapy clients. So you can see here how someone who did not have therapy, that curve is a little bit lower than someone who did have therapy. Again, those reasons might be some of the things we said before, that it's not necessarily the therapy itself that's 100% effective, but instead other factors that kind of go into it. But let's stop for our first question here. What is a meta-analysis? Which of these answers here? All right, that is letter E, a way to combine the results of many studies. Awesome. So, going back to what we were just talking about, the verdict is that lots of subsequent summaries have now examined psychotherapy's effectiveness. Those not undergoing therapy often improve, but those undergoing therapy are more likely to improve and improve more quickly and with less risk of relapse. So, like I said, a lot of people tend to just improve on their own anyways because it's like a time thing. You just need to let some time go by, or maybe some situational factors change. But they do see that there are more improvements with those who actually do undergo psychotherapy. Which disorders respond the best to different kinds of therapy? So the more specific the problem, the greater the hope that psychotherapy might solve it. Those with phobia or panic disorders or who are unassertive can hope for improvement. And those with less focused problems like depression and anxiety usually benefit in the short term, but unfortunately often relapse later. Continuing on with that, we see with our cognitive and cognitive behavioral therapies that they best tend to help anxiety, PTSD, insomnia, and depression. Specifically, just behavioral conditioning therapies help with some behavior problems that we have, like bedwetting, phobias, compulsions, marital problems, and sexual dysfunctions. Continuing still, psychodynamic tends to help best with depression and anxiety. And then our client-centered, like our humanistic therapy, is good for mild to moderate depression. So then we need to look at evidence-based practice and what that means. And basically that is a clinical decision making that integrates the best available research with clinical expertise and patient characteristics and preferences. That's a really long, wordy thing to say that it's using like scientific research and then also taking into account the client themselves and the therapist and what they kind of decide works best. But it's definitely using research backed things, not just like, well, let's just try this out. You want to have some research behind that. So like you can see here, there's kind of like these three pillars of evidence-based clinical decision making. There's the patient themselves and their own values, characteristics, things like that. There's the clinical expertise. And then again, there's the best available research evidence that we have. So it's really good to make sure if you are going to engage in therapy that there's some research back it there. Another alternative form of therapy is called EMDR, eye movement desensitization and reprocessing. I will say, as I explain it, it kind of can sound a little bit like kooky, not necessarily everyone buys into it right away, but it's kind of the idea where you're trying to almost distract part of your brain so that it's like cognitively overloaded, and then you can kind of bring up some other pieces that are in your mind and everything. So basically what happens is you might do something like having your finger where your therapist would kind of move the finger back and forth and a client would just focus their eyes on the finger. This is not the same as hypnotism. I know that might be something you think of too, but it's not hypnotism, separate things. So anyways, as you are focusing on watching that finger move back and forth, the thought is you are so focused on that it allows for some like unearthing of some of those traumatized feelings you might have if you're someone that is seeking it because you had some kind of traumatic experience. That's kind of the way that EMDR therapy works. So there are some people who are skeptics, which acknowledge EMDR does work better than doing nothing, but not everyone's totally into this idea here. So some people say that it's just as effective with fixed eyes, meaning that you're not looking back and forth. So maybe then that means what's useful is the therapy itself, like the talking part of it, not necessarily the let me look at your finger part. So it could also be partially because of the placebo effect as well. So I do have to say though, I read a book about EMDR and a lot of research with that this summer, and I did find it really interesting. There is a good amount of research that does support it, but it is kind of, some people are fans of it, some people don't buy into it. It's just kind of your preference. Another alternative form of therapy is called light exposure therapy, which is used most especially for people with seasonal affective disorder. It's called SAD, S-A-D. And a lot of times that happens when people end up feeling very depressed in like the winter months when it's a lot darker outside. And so literally sunlight is something that improves our moods and makes us feel better. So if people are kind of lacking that natural sunlight, that's the idea of where light exposure therapy came from. So the idea is to then expose people to like simulated natural light, basically, to kind of help you to gain some of the like positive feelings, endorphins that you need from light. And sure enough, people report that they feel better. So let's see. Yeah, and they did that with, they had a control group as well where people just had some like noise that was on and it was a negative ion generator, which it made them think that it was the actual natural light, but it wasn't. And it still tended to show improvements in a lot of people. So again, you know, kind of placebo effect and everything. So the verdict is studies have shown that 30 minutes of morning exposure to 10,000 lux white fluorescent light produces relief for most depressed people. So that's kind of a good starting point. Obviously, there's a whole cognitive component behind depression, but the light exposure therapy can kind of at least kind of help to get you back to a baseline that then you can go from there with other therapy. So Trevor spends 45 minutes a day in front of an intense light. It's most likely he's being treated with which of these things that we just talked about? Yes, you are correct. That's letter B, light therapy. All right, and then what benefits do all of our different kinds of psychotherapies share? So one really good thing is it brings hope for people. People who are seeking therapy want to have some kind of improvement. So it brings a sense of hope. It also brings a new perspective. So you have each different kind of therapy brings a different potential explanation of your symptoms. Also, just a new perspective from other people that you might talk to on a daily basis. I think that it's really different when you might hear something from like a therapist as opposed to your best friend or a parent or a family member who might be telling you the exact same thing. But you know how sometimes you just have certain reactions when like a family member tells you versus if a stranger tells you, or someone else that you know decently well, but they're not in your family. You might tend to listen to them a little more. Also, it provides for an empathic, trusting, caring relationship. So you can build a close connection with someone who you know is going to listen to you and try to help you with whatever problems you feel like you're having. There's also this sense of therapeutic alliance, which is like this bond of mutual trust between the client and the therapist. What kinds of things should you look for if you are trying to select a therapist? You should ask about the therapist's treatment approach. So, like, what kind of therapy do you do? Also, the therapist's values. I'm kind of going to mention more of that in a moment, but sometimes if your values don't match up with your therapist, that can definitely make the sessions not quite as beneficial as they could be. And then also, definitely important to know the therapist's credentials, like do they have a PhD or some other kind of license? And of course, what's the price? How much do they charge? Is it something that's covered by your insurance? Is there a limit to how many sessions you can have? All those kinds of things are really important questions. So this is kind of what I was just getting at a moment ago. Culture can definitely have a big impact on client-therapist relationships. So for example, we've talked before about individualism versus collectivism. And in individualistic cultures, it's primarily focused on the individual themselves, whereas with collectivistic cultures, that is focused more on other people. So these clients might have trouble relating to therapies that require them to think of only their own well-being, because that's just not how your society generally tends to think about people and your interactions with others. Also, people who live in cultures of honor, so they might prize being strong and tough and might see some kind of mental health care as feeling weak in some sort of way. And I feel like that's unfortunately a common belief that might be out there with therapy, but it's definitely not at all a weakness. It's actually an incredibly strong thing to be able to try to find someone to help you overcome some of your struggles and everything. Also, some minority groups might tend to be reluctant to seek therapy and also quicker to leave it. If you have a mismatch between the therapist and client, that definitely makes it more difficult. Again, as I mentioned, because of things like if you have different religious values, that could then, you might have a certain perspective on things and your therapist says something else that doesn't match your beliefs. That might kind of challenge who you are a little bit, and you might not like that. The point of therapy is not necessarily to change all of your beliefs and everything. It's more just trying to change your mindset and some of the thoughts you might have with that. So that can definitely be an issue if there's a mismatch between the therapist and the client and their belief systems. Please take a minute to look at each of these bullet points here. It's really important to know if you are ever suffering and you just aren't feeling good for a prolonged period of time, when is it time for you to seek out therapy? So here are some different like factors you should kind of look for in yourself, or if it's in someone else that you want to offer help to. If you're having feelings of hopelessness, deep and lasting depression, self-destructive behavior like substance abuse, disruptive fears, sudden mood shifts, thoughts of suicide, compulsive rituals like hand washing, and hearing voices or seeing things that others don't experience. You might also be able to pick out with each of those bullet points there what kinds of psychological disorders they might be referencing. But no matter what, it's really important to make sure that you know you are not alone and that you seek out help from other people, because there are also so many people who experience different psychological disorders. So definitely don't feel alone if you do feel like you have any of these different kind of like symptoms here. All right, so here are different kinds of trainings for therapists. You can take a look at that on your own, but some of them have a PhD. If you're a psychiatrist, they can prescribe medicine. You do want to make sure that you know that difference between psychiatrists and like a clinical psychologist. Also, like there could be a counselor instead or a social worker. So you can look into those kind of credentials there on your own. But that is it for Module 72. So let's hop to Module 73 now, which is the biomedical therapies and preventing psychological disorders. So first thing to focus on is lifestyle. How does lifestyle impact your mental health? So your lifestyle is all the things like your daily choices you make in terms of, am I going to exercise or am I kind of sitting down all day long? Are you putting healthy food into your body, or are you choosing more of your junk foods and comfort foods? What are your relationships like? Are you staying by yourself or are you seeking out other people? Your recreation, relaxation, religious and spiritual engagement, all of that goes into influencing your brain and your body, and that then affects your mental health. We've talked about this before with like our module that mentions stress and everything, but your brain and your body, your mind and your body are so interconnected, that just things that you might do, even things like we said, like feeling stress, can really take a toll on your entire body. So it's really important to make sure that you are thinking about your different lifestyle choices here. And I do want you to take a minute and pause the video here and actually answer this question. So in what ways do you think that your lifestyle is affecting your mental health? Think about it. If you're feeling pretty down, is there something you could do that's simple maybe to start help you feel a little bit better? Like go for a really short walk, like just down the block and back or something. Or is it just calling up a friend or getting off of a computer? Because I know that we spend so much time on computers now. So really take a minute to think about how you are currently, what kind of lifestyle you currently have, and if maybe you should get a little more active or try to eat a little healthier, any of those different kinds of things. Because your lifestyle choices is definitely one of the, I'll say like easiest to access points of trying to improve your mental health. So rather than seeking out therapy or your biomedical therapies or something, it might first be in your best interest to see if there's some lifestyle changes that you can make to try to help some different factors on your own. It might just be situational things that are making you possibly feel a little sad or something like that, rather than it being that there's something chemically going on in your brain. So let's think about these different things here. How are humans designed? We were designed for physical activity and social engagement. Our ancestors hunted, gathered, and built in groups. Obviously, I know that this past year has made that really hard to be able to interact with other people. And I definitely think that's a huge reason why there has been like a big increase in people reporting feelings of depression and everything throughout the past year, because we are designed to be social animals. We really are. So the coronavirus has for sure made it very difficult on mental health because we can't easily access that piece of connecting with other people. So that's why it's really important to make sure you're getting creative with it, because even though you might not feel like being on a computer anymore, it's still better to chat with someone through a computer or on a phone call than not at all, and to just kind of isolate yourself. So it's really important to find those ways that we can actually benefit from all the technology that we have to try to connect with other people still, or play video games online with them, watch Netflix movies together, whatever. Physical activity, though, we can still access in a lot of ways. Obviously, for a while, gyms were shut down and everything, but there's still always the outdoors, and you can hopefully find a spot that's away from some other people where you can go for a walk or a run or just do some kind of cardio activity outside. But that is one thing that definitely helps to reduce stress and promote better health. So again, we talked about aerobic activity before with our stress unit, so I'm not going to talk about it too much here, but can't stress it enough how important physical activity is. And again, that's one of the easiest places to start to try to help if you are having some mental health issues. Socializing, like we said, is very important. It helps satisfy the need to belong. Sleep, 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 sleep. I can't say it enough. It's so important. Sleep is just super, super important for your body. And believe me, I have been in all of your shoes. I was in school at one point and everything, and I absolutely sacrificed my sleep so that I could get work done sometimes or just stay up late doing something fun. But I have absolutely realized how detrimental that is to your body. Sleep is so important. And again, I know it's hard to hear that from other people sometimes, or like maybe from your teacher or something. But I'm telling you, it's really important. I really hope you take my advice with that to make sure you are getting better sleep hygiene. That is something that literally shapes your entire day. And it really can have a bad effect on your body if you're not getting good sleep. So lifestyle changes can definitely help to relieve depression. So like I said, that's maybe a good starting point if you are feeling like you might have some symptoms of depression. What is psychopharmacology? So that is the study of the effect of drugs on our mind and behavior. So I'm actually going to skip that slide there and that one. But here are kind of some of our different categories of drugs. And you should make sure that you know what kind of disorder each category of drugs seeks to help. So for example, our first one is antipsychotic drugs. These drugs are mostly used to treat people who have schizophrenia and possibly other severe thought disorders. So there are some different antipsychotic drugs that have really, really hard to pronounce names. So I'm sorry, I'm not like a medical person, but chlorpromazine, which is also known as Thorazine, that is definitely something that is supposed to help with schizophrenia. But of course, there are also sometimes side effects with drugs, and some people who have schizophrenia choose not to take these drugs then because they don't like the different side effects that they might have. But these drugs are shown to help with some of the positive symptoms of schizophrenia, like your auditory hallucinations and thoughts of paranoia. So, like I said, they have some powerful side effects, though, like sluggishness, tremors, and twitches similar to those of Parkinson's disease. A big side effect that could potentially happen also with antipsychotic medication is called tardive dyskinesia, which is involuntary movements of the facial muscles, your tongue, and your limbs. So some people, like I said, are like, I would much rather not have to deal with that and not take this medication instead. So the way that antipsychotic medications work is focusing on dopamine. That is your big neurotransmitter. So that's another thing you want to make sure you know, in addition to which categories of drugs go with which disorders, also knowing like how do they work? Why are they supposed to help with that one? And so for schizophrenia, one of the big theories is that there's an overactive dopamine system, which contributes to schizophrenia. So antipsychotic drugs act as an antagonist for dopamine, meaning it's trying to block some of that activity so that there's not so much dopamine going on all the time. All right, so which neurotransmitter is affected by antipsychotic medications? As we just said, it is letter B, dopamine. Next category is anti-anxiety drugs used to control anxiety and agitation. So drugs like Xanax and Ativan depress our central nervous system activity. Some anti-anxiety drugs have been successfully used in combination with psychological therapy to enhance exposure therapy's extinction of learned fears and help relieve the symptoms of PTSD and OCD. Next category we have is antidepressant drugs. So obviously one thing that helps to treat is depression, but that's not it. A lot of times these drugs also help with anxiety disorders, OCD, and PTSD. And that's because they work on the neurotransmitters norepinephrine and serotonin, which can then help to elevate arousal and mood. And when someone is feeling depression or anxiety, those neurotransmitters are lower. So these antidepressants help to bring some of that there. Specifically, one really important kind of antidepressant drug that you should know is called this category called SSRIs, and that stands for selective serotonin reuptake inhibitors. There's also something similar called an SNRI, which is selective norepinephrine reuptake inhibitor. But it's a really long, lengthy name, but if you break down each word, you can figure out exactly what it is and how it works. So if it's selectively selectively inhibiting the reuptake of serotonin, that means if you got your two neurotransmitters, there's your serotonin going from one neurotransmitter to the next. Then remember, when it's done doing that, it goes through the process of reuptake, where any serotonin left in the synaptic gap is reabsorbed into the sending neuron. But what an SSRI does is it kind of gets in there and it blocks that reuptake from happening so that there's more serotonin that kind of hangs out there in the synaptic gap. And that means that then you'll have more of the benefits of the serotonin than if it's kind of like staying in your system a little bit more. SNRI works the same thing, but with norepinephrine instead of serotonin. So it works to prolong the time that serotonin molecules remain in the brain's synapses. And some of these drugs include Prozac, Zoloft, and Paxil. You can take a look through this here. It's basically exactly what I just explained, but how does an SSRI work there? So feel free to look through that more if you need a little more clarification. What do our double-blind trials regarding the placebo effect show? Quiz yourself real quick. Double-blind, what does that mean? What does that mean? That is when both the participant and the researcher do not know which experimental group the person is in. They don't know if they are receiving the actual drug treatment or if they're receiving a placebo, which is like a fake drug. So in double-blind clinical trials, placebos produced improvement comparable to about 75% of the active drug's effects. There's definitely a big placebo effect going on here. But for those with severe depression, the placebo effect is less and the added drug benefit somewhat greater. So with just like moderate depression, placebos do tend to help, but with severe depression, the actual medication helps more. So that is a good point to bring up here. So if one suffers from mild depression, might an alternative therapy work as well as medication? Great point, because we see how a placebo is working and everything. So maybe you don't need to turn to some kind of drug therapy right away for someone with mild depression. I'm going to skip this slide here. Next category that we have are mood stabilizing drugs, and they are used to help control the manic, out of control feelings that come with bipolar or some other disorders. So mood stabilizers I would definitely associate with bipolar disorders. Depakote is one kind of mood stabilizer. It was initially used to treat epilepsy, but they found it also kind of helps with bipolar as well. And another kind is the simple salt lithium. I would say I really often see mood stabilizer and lithium, bipolar disorder, all of that linked together. So it's important to know like lithium is one thing that can help with bipolar disorder. You can look into this a little bit more about some of the benefits of lithium. I'm going to skip that for time's sake. So then that's it for the the drug therapies and everything, psychopharmacology, that side of things. But then there are some other alternative medical therapies that can happen as well. One of those is called ECT, electroconvulsive shock therapy, which is primarily just used for severely depressed patients. So definitely not ones that other medication might work for, but it's a brief electric current that is sent through the brain of an anesthetized patient, meaning they're not awake or conscious or anything like that. The idea is kind of it triggers a 30 to 60 second seizure. The idea is almost to kind of like reset the brain and try to like reset some of the wiring and everything so that hopefully it brings a person again just back to like a baseline level. It is not a cure-all, you're fixed now, you're good to go and everything, but instead it's kind of to bring you back to a baseline level that then maybe some of the psychotherapy or possibly the biomedical therapies can work for you. It's kind of freaky though that within 30 minutes then the patient awakens and remembers nothing of the treatment or of the preceding hours. So this is definitely not your first go-to resource for treating depression. It is kind of like you've exhausted other options. So then like we want to try this one next. How effective is it? We see the results of ECT in treating severe depression are among the most positive treatment effects in all of medicine. So that is definitely good news, but again, it's kind of a last resort thing. It is not your go-to starting point for therapy. There's also a transcranial direct current stimulation, which is TDCS. So where the ECT produces a brain seizure, a transcranial direct current stimulation administers a weak like current to the scalp instead. So it's kind of like a lesser form of an ECT, basically. I will say that I don't see a lot of questions about this one too often, and ECT is more common that there would be test questions about. Next is a repetitive transcranial magnetic stimulation, and that's when you are going back for several weeks. So repetitively, just like this says, repeatedly you are going back to have like these pulses surging through your brain, basically, that kind of help to suppress activity in areas of the cortex or possibly stimulate as well. It does not produce any memory loss or other serious side effects aside from some possible headaches. So it's definitely more of a lower stakes kind of therapy here. Then there's also deep brain stimulation. Yeah, there's a little bit you can look into there. Honestly, I would say ECT is definitely the most common test question that you might see, as opposed to some of these other alternatives here. But also, you do want to make sure you know about psychosurgery. That is a surgery that removes or destroys brain tissue in an effort to change behavior. It is an irreversible thing, though, because you're literally going into the brain at that point. It removes different parts of the brain or the brain tissue and everything. So it is for sure the most drastic and least used biomedical intervention for changing behavior, because it's going to be very dangerous and, like we said, permanent for sure. So thinking back to all those ones we just mentioned, Juliet's depression is not responding to the normal biomedical treatments. Her therapist has suggested that she try several sessions of what to energize her left frontal lobe and reduce her symptoms. Although I said this is something that really isn't part of your biggest testing questions, this would be letter B, RTMS, and the big giveaway is because it's several sessions of it, because it's repetitive, you go back again and again. Again, I would think ECT is your most common type that you would possibly see on a test, though. Along with a lobotomy, you should know what this is. It is not commonly used because it's one of those psychosurgeries that were just kind of alluded to, but it is a term that you should definitely know for sure. It's a psychosurgical procedure once used to calm uncontrollably emotional or violent patients. So again, kind of like a last resort thing. And it's where you cut the nerves connecting the frontal lobes with the emotion controlling centers of the inner brain, which was in the hopes of trying to calm uncontrollably emotional and violent patients. Unfortunately, it was not always a successful thing. Obviously, it's highly dangerous and risky and everything too. Rosemary Kennedy, who is the sister to John F. Kennedy, she was someone who had a lobotomy. Unfortunately, it definitely did not go well and left her confined to a hospital with an infantile mentality until her death at age 86. So this is definitely not our go-to method here, but it is something that used to be used and you should make sure that you are aware of. So like I said, is psychosurgery used today? Sometimes in very extreme cases, for certain reasons like uncontrollable seizures, if they feel like they can target certain areas, then they might do that. But again, because the procedures are irreversible, neurosurgeons perform them only as a last resort. So here are your different kinds of biomedical therapies you can look at, such as your lifestyle changes, your drug therapies, brain stimulation, and psychosurgery. Definitely take a moment to pause and look through this chart here. And honestly, I'm just gonna skip this last part because that part wasn't super important there, but I do want to mention these last two things. Resilience, that is the personal strength that helps most people cope with stress and recover from adversity and even trauma. So a huge thing is you might undergo some kind of trauma or have some kind of mental disorder, psychological disorder and everything, but you can absolutely overcome some of those things and you can become stronger because of them. So resilience is basically your ability to go through something really tough and come out even stronger, basically, and still jump back from it anyways. The good news is we see that humans are incredibly resilient people. So that definitely means like there's always hope and stuff. A lot of times we might suffer for a bit and we might struggle, but we are able to turn things around in the end. So that is resilience. It's related to also post-traumatic growth, which is after you struggle with an extremely challenging circumstance and life crisis, then you kind of show that resilience and everything, and have post-traumatic growth. For instance, many cancer survivors have reported a greater appreciation for life, more meaningful relationships, increased personal strength, and changed priorities and a richer spiritual life. So, undergoing some really difficult times can help you to become, maybe like you want to say, a better person or appreciate more things in your life and just really grow as a person. So if you're struggling, going through some stuff, keep this in mind. Like I said, humans are very resilient. We can overcome a lot of obstacles and come out even stronger on the other side. All right, so that is it for modules 72 and 73, which means you have reached the end of unit 8. Congratulations, great work. We only have one unit left to go for the year. That is unit 9, social psychology. Personally, it's my absolute favorite unit, so I'm really excited for it. But great work. Make sure you filled in your unit 8 slide deck, and we will see you all in class. Have a wonderful day, everybody.